my elite expertise alumni who cleared KAPS in the year 2023 July. I took her first interview, if you remember, Faria.
Yes, I can. I was so afraid. I must say I was afraid because I have completed my bachelor about 6 years back. So I was not able to recall all the 5 years things in one go to pass a single exam. So that's why actually I was looking for any of the platform which can guide me to pass the exam. And that time I meet Harika ma'am and Arish sir, which I'm really blessed because today I'm smiling for that reason.
Are you on any, are you having permanent residence?
Yes, I'm having my permanent residency in Australia. But after moving in Australia, I thought the pharmacy profession would be the best one. Actually, I was thinking when back in home, I was thinking of doing PhD. But when I was doing MPhil, I came here to do my MPhil. When I was doing my MPhil, I had a very hardship to go through. And then I thought, okay, fine, this is the time actually to choose a profession. So nothing have to worry for the next 5 years. So that's why actually I chose the pharmacy profession, and that's why I joined with you guys, and then still until then I was with you. The live sessions are very, very important for the oral exam, I would say, because you can practice. Actually, you can practice.
When you practice, I think you came and you were able to do, I think, 5 exams, I think.
Yeah. End of the few days, sir used to do all the session, throughout the whole day we were doing the practice, and you also conducting the exam sessions, which were really helpful, I would say.
Hello guys, this is Harika doing another video of Faria, my elite expertise alumni who cleared KAPS in the year 2023 July. I took her first interview, if you remember, Faria.
Yes, I can.
And what did you say?
The result date, and we were so excited.
Yeah, I think you gave an interview on the first day of the result, right?
Exactly.
In July.
Exactly.
Yeah, I remember that. And now she's here, fully qualified pharmacist, going to step into the pharmacist world in Australia. So congratulations, Faria. Successfully cleared your pharmacist intern written exam. Congratulations on clearing KAPS exam last year. Congratulations on clearing intern written exam and intern pharmacist oral exam this year. And straight away, first attempt, you're going to become a registered pharmacist soon. I think did you finish your OPRA?
ITP actually I submitted, so waiting for the guild. Yeah.
Okay, you're waiting for the guild. So very soon. It won't take long.
Yeah.
Okay. So I think
within this month.
Within this month, I'll see your APRA number in the record as a registered pharmacist.
Yeah, inshallah.
Yeah. That's so sweet. So you're originally from Bangladesh, isn't it?
Yes, I'm from Bangladesh.
Okay. So are you on any are you having permanent residence?
Yes, I'm having my permanent residency in Australia. But after moving in Australia, I thought the pharmacy profession would be the best one. Actually, I was thinking when back in home, I was thinking of doing PhD. But when I was doing MPhil, I came here to do my MPhil. When I was doing my MPhil, I had a very hardship to go through. And then I thought, okay, fine, this is the time actually to choose a profession. So nothing have to worry for the next 5 years. So that's why actually I chose the pharmacy profession, and that's why I joined with you guys, and then still until then I was with you.
That's so sweet of you, always smiling and cheerful. And so you are here, almost close at your general registration. So why did you delay your guild assignment?
Actually, during the whole internship period, all interns have to go through a very hard situation. So that time, actually, I was thinking, okay, actually, I started last year, December, though I passed on July. But until December, I didn't get my AFRA provisional registration number. They took a long time. So from January this year, from January, I started my hours, counting my hours, and in between having some hardship. So that's why I was thinking, okay, fine, first finish all the exam and then do the assignments. Basically, I already did. There are 3 submission in guilds. I think you already know because you are with the guild, and I took your suggestion.
I went with the Gil. I feel like Gil was very good for me. Like I liked it.
Yeah. So that's why actually I did 2 submission earlier. I was waiting for the last submission, but I didn't want to like overlap with my exam. So that's why I just postponed the 3rd submission. Yeah, that's it.
Okay, that's good. How did you feel when you received your, I think I should say, oral exam result, Intern Pharmacist oral exam result?
Actually, to be very honest, I was so tensed about my written exam, not even the oral exam, because I was overconfident, like I'm gonna pass the oral because the how I performed and how the exam
How the rest
exactly reacted. So I was sure like I'm gonna pass the oral. But the written exam, it was time bound, and like mm, we have to measure the time very wisely. So and like all the questions are the clinical questions. So that's why I was a little bit tensed about my written exam, because like I don't know which question was the unmarked question. Like I was worried whether I did all the unmarked question as a correct one and the marked one as incorrect one.
questions, yes. You were just scared. Okay.
Yeah, exactly. That's the reason actually only. But I was confident about my oral.
Okay, so that's good. That's sweet. I think in the mock test also you were really doing good. I think first mock test you didn't do well, but after
Exactly.
you were bang on.
Exactly. I took off to like when I get my oral examination date, I was panicking because I didn't participate none of the or like live session. I was doing the recording, but the live session are very very important to for the oral exam, I would say, because like you can practice. Actually, you can practice
when
when
in practice, I think you came to the end and you were able to do, I think, 5 exams, I think.
yeah, like end of the in few days, like end of the few days, like sir used to do all the session, like throughout the whole day we were doing the practice, and you also like conducting the exam sessions, exam sessions, which were really helpful, I would say. Like those things actually I was focusing that time. Like I was thinking, okay, fine, whatever it is, I have to participate in those sessions because I have to pass the exam. And those words actually, like whoever is going to sit the exam, I would say like definitely participate the live session. At least
Live mock session. Yes.
exactly live mock session.
Live, they'll give you more confidence in the real exam. Yeah,
Exactly.
You have to be the intern answering the questions
Hmm.
and solving the problem. Then only you'll get that real life, experience how to solve the real life exam. Yeah.
Exactly. And like whatever, like how much I practice by myself doesn't matter, because whenever I am practicing with someone else, like I'm totally blank. I think it happens to everyone whenever they are practicing for the first time. So the more I was practicing, the more I was feeling confident. That's the main thing actually. I cleared my oral exam, I would say.
Yeah. So
Thank you for arranging all those extra sessions. And I used to like say, I will participate. I will do. I will do.
I want to wait. You already got the chance, right? So funny actually in the sessions. That was so good. You actually added some light into the sessions. Otherwise, I would be so boring. And actually, I wanted to ask, your written exam result came first and then oral exam, right?
Yeah, exactly.
Okay. So I think you were more relieved with written exam result.
Yeah. But But like after even written exam, I was a little bit tense because exam is exam. You don't know what's gonna happen. What's
Yeah.
gonna happen? So that's the reason. That's the another reason actually about the
Yeah.
oral. But like for the oral exam, I would say like everything is like the core of the oral exam passing is the history taking.
True.
History taking.
100%. Yes.
History
Wrong
taking.
history taking will lead to wrong answer, and then you'll never be able to clear the exam. The main thing is history taking. It should last
Exactly.
for enough time so you get all the answers required for you to find the problem. Otherwise, if you're rushing, even though if you clear or solve the problem and communicate well, but if you don't take proper history taking, they're going to fail. Yes.
Exactly, because lots
Important.
of lots of candidates like who took the exam at my session, they couldn't actually solve the problem because they
Mm,
didn't ask the question properly, and the examiner, like, that is our responsibility to ask the question.
that's yes.
Exactly, and if we don't take the history taking template to the exam, then we are gone.
True. Because I have made that template because I know where I go wrong. And I think Sir and I, during our preparation, we made that template, not to miss even one question. And I think the template will cover everything. If we practice with the template and don't forget to take the template in the exam. I think for primary healthcare, it's okay. We can manage, but for history taking template is very much required. We think that we will do it without it,
Hmm.
but definitely we'll forget things.
Exactly. But like even for the primary healthcare, like the flow, always Arisha used to tell. I always said that one in my mind. Maybe I didn't take, like, we are not allowed to take any history taking for the history taking template for the part one.
Yeah,
But like as the more we practice, actually, it's set into our mind. It's set into our mind. So same as the part three as well. But we have to go through each question, because like lots of the candidate I can remember on that day, like they were so stressed because they couldn't find the answer because they didn't ask the question like, is there any recent change?
true. That question is so important. Is there any
Exactly.
that question is so important, and you'll end up having a heart attack in the exam.
Exactly, I understand. And the exam is always stressful, no matter what, how much we practice, how much is in our mind. But like after part A and part B, like nothing is set in mind. So always the history taking is the like the saving, life saving thing.
100%. That's a very good takeaway point in today's interview with Faria. History taking is the most important thing for you to clear the exam. You
Exactly.
might
I would say like that is the only reason like I could solve the part C, because I have seen everyone on that session. Everyone was able to do part A and part B, but they were
but not-
not able to do the part C. Like
and
I
you're the
see
only
lots
one
of.
who like really did well and really was so confident. That's very good. I'm so proud of you. You said that, Faria. I'm
Thank
so
you.
proud of your history taking skills. You-
Exactly the way you prepared, like I should have admired. Okay, like no one, like even examiner was so hard. They have to answer. They have to answer because I'm asking.
you just get the examiner to answer the question by asking the right question. Otherwise, they can say any other answer
Hmm.
and they can go away. And then we have another question coming, which is a similar one. We may think it's similar, but for examiner, it is the right question. And they are waiting for that. And surely, like, they are waiting for that question, and only then they will answer. If you see the examiner template, you will know. So I think history taking is the most important one. And Faria did well in that. And that's why she's here today giving an interview. Congratulations.
Yeah, I'm telling, like everyone, like whoever is going to sit the exam, definitely for part C, history taking. Whatever, how much you practice doesn't matter. Have to take that template with you. That's it.
And Faria, so which state are you practicing? Victoria, right?
No, NSW.
Oh, okay. You're in.
Sydney. Yeah, Sydney.
Congratulations. I think it's a party time for you. And thank you so much for being a lovely student of ours. And now we don't have any opportunity to train you. So thank you.
I will be always. I will be in touch. Okay,
Thank you so much.
because expertise matters. I know. So I need to come back to you again and again.
That's so sweet. You don't have to actually.
No,
That's, that's so kind. You're now a pharmacist, so I hope you'll see greater heights in your life. Congratulations, and thank you for coming down and giving an interview.
No worries. That's my pleasure, actually.
Thank you, guys.
Thank you.
Thank you, Faria. Bye.
Thank you, ma'am. Thank you. Bye.